Well, welcome everybody. This is our first podcast. We are CPD Plus, and we're here to provide education and support for endorsed pharmacists across Australia. And with me today, I've got two fantastic guests, and we'll like to introduce them both. And I'm going to start with Peter Antique. Peter, if you want to unmute yourself and tell us a little bit about your story.
Thanks, Ewan. My name's Peter Ann. I'm a GP, an old GP. Have worked clinically for a long time now and have been involved in this space of pharmacist scope of practice really since the inception, well, earlier than the inception, when people were thinking about how to support stability of patient care in rural and remote areas. I'm very passionate about this project. It means a lot to me personally, but also in the areas where I work clinically, there is potential, and indeed we've seen what this can do for primary care.
That's fantastic, Peter Ann. I'm going to move over to Peter. Peter, let's hear about your expertise and what's really driving you to form this podcast and this program of education for endorsed pharmacists.
Thanks. My name is Peter Figre. I'm a pharmacist of many years as well. I have always been passionate about the role that pharmacists play in our community. I did the Cohort 3 Pharmacy Full Scope training with Peter Ann and the crew from JCU. And I've just been overawed by the uptake and the response to the community. But I've always believed that pharmacists can be doing more in healthcare. And I believe pharmacists and GPs should be working closer together. So that's what's brought me to here.
I'd like to introduce myself. My name is Ewan McPhee. I'm a rural generalist and GP as well. And I've lived in my Emerald community now for 36 years, and I'm very enthusiastic about teams, about collaboration between general practice and pharmacy. Look, there's no doubt that we need to work together and we need to understand our roles. But also, I'm so passionate about helping pharmacists to work to the top of their scope, to help patients every day, and to be well linked in with other team members. Look, I'd like to also introduce Wendy. Wendy's our admin person, and she's joining us for the first podcast. And she's one of the admin people behind CPD Plus, the website, and assists the team when they go out and do live workshops. So look, I'm going to jump into some questions now. I will leave it up to you, Peter and Peter Ann, as to who wants to answer them. But look, what does collaborative care between endorsed community pharmacists and GPs really look like? What do you think? Peter Ann.
I might go first, Peter, but we can have a conversation about it. I wanted to just take a step back and to say when this idea was first mooted to me about what additional skills or care could pharmacists be delivering in communities, I actually went to a very busy pharmacy, nowhere near where I work, but actually on the Gold Coast one night. It was fairly late at night, and it was one of these pharmacies, the community pharmacy that's open till very late. I didn't tell the pharmacist I was there, and I suspect I looked very suspicious, but I just kind of wanted to understand what was going on in that pharmacy after hours. And there was a long queue of people at the desk, and what I overheard people bringing to the pharmacist at this time of night really astonished me. The complexity of things that were being presented, the lack of time that the pharmacist had to really think about what was being asked of them, and really overall how quickly they were able to kind of make some decisions and help the patient in that moment in time. And it was almost this light bulb moment for me, was that if these patients weren't there at that time, where would they be going? Would they be at an ED? Would they be on a telehealth? And I thought, gosh, imagine if we were able to construct a system or be part of a system where pharmacists were able had more time in a quiet space to understand the patient's concerns and really take a history from them and do some diagnostic reasoning, that potentially the outcomes would be less of, well, you probably need to see your GP, or you probably need to go to ED, and more to be able to manage that consultation at that time. So Ewan, perhaps Peter and I could ask you a question, because collaborative care is something we talk a lot about. But what does that look like for you in Emerald, where you work, or how would you like it to look?
Thank you. Look, with my my practice, Emerald Medical Group, we have a pharmacy on the front of the practice, and we've worked closely with pharmacists since the opening of our new practice some 10 years ago. And we realise how important it is that we support our pharmacists, and we've also had JCU students, so student pharmacy, coming into the practice and being supported to do consultations with a GP watching them and supporting them. But look, it's essential. If we didn't work together, we wouldn't be able to optimize patient care. I mean, pharmacists need to be confident that they can talk to a GP in a professional manner, and they can, if they're concerned about medication, they know how to reach out and ask a question. And the same for the GPs. My practice is a learning practice. I have many registrars and even interns. And being able to speak with a pharmacist in their intimate knowledge of pharmacology, but also the drugs involved and interactions, is fantastic for their own learning. And I think in smaller areas, as you said, we cannot be islands. We have to work together. Our patients, and we, as Peter has said, we have to look at what's important for the people of the community. And what the people of the community need is a team. They need a GP, they need a pharmacist, they need other allied health professionals, they need great nursing staff who also are linked in and working toposcope. And I think that it's really important that we acknowledge and set aside the politics, set aside the putting flags in the sand and say, hey, we got to work together here. And I think a lot of pharmacists would agree that it would be much nicer if we were collaborative and shared that journey and supported our patients in our communities. And there are communities in cities as well. It's not just one homogenous group of people. There's culturally and linguistically diverse people who have pharmacists who work really closely with them. We have our Aboriginal and Torres Strait Islander people who need pharmacists and need people to support them in their understanding of modern medicine and how even that might integrate with their own traditional healing. So I think this is a great opportunity. And JCU and you guys have really pulled together a program that pharmacists can work with. And of course, this is being reproduced right across Australia. So I'm really enthusiastic to see how it goes. Look, what I might do is ask another question of you both. So, Peter, what are the barriers and enablers of being able to build the sort of model we want to see with a collaborative pharmacy, pharmacists working as top of scope of practice, pharmacists being able to be confident with some clinical reasoning, clinical diagnosis, but also when to hand over?
Yeah, thanks, Ewan. This has been a fascinating process for me because, what you described earlier, Ewan, was that the importance of that close working relationship between pharmacists and GPs. It is something that I've always striven to do wherever I've worked, to know the names of the local pharmacists and who to talk to, and always take their calls if they phone. So that there's a trusting relationship between these two. For me, the barriers here is that it's a different way of thinking, and it is a very controversial way of thinking in many ways. And I think it's only reasonable to acknowledge how often we as GPs, Ewan, feel undervalued, not necessarily by our patients, but by the kind of broader system of being expected to have this huge scope of practice and, provide quality care all the time under a lot of constraints and difficulties. So I think I understand some of those criticisms of this where the fear is fragmentation of care. And I think that is potentially a barrier, but if done in the way that we were describing and what Peter was saying, put the patient at the center, let's practice safe, effective, team-based care of patients, then for me, that is much less of a barrier than people might fear. Ewan, if I may, I also just want to explore something that comes up a lot in conversations, which is one of the things that we have always valued, or I have always valued as a doctor, is that the pharmacist has sort of got my back. Is that distinction between the prescriber and then the dispenser. And one of the big criticisms, as you know, Peter, has been that is potentially falling away here. What do you think about that as a barrier?
So is it me or Ewan?
Over to you, Peter.
I think I can understand where the barrier comes from, but I think it's just going to be as these interactions go. Only time will improve that situation. I just think that once there's an understanding of the training we go through, and GPs are hearing from pharmacies more often on that front, that there will be just this build of trust. And I think it's just it's a time thing.
For me, the importance is to acknowledge this as a potential issue and for there to be safeguards around this. So, for example, completely understand you're in a sort of rural 1 or 2 pharmacist area. It's a Sunday afternoon. Someone comes in. Their presentation is consistent with shingles. They need antivirals. You are the only pharmacist on. You're going to prescribe and dispense. But it's understanding what safeguards can be put into that. For example, would you have a colleague you could call to say, I just want to tell you, this is what's happened. This is my diagnosis. I am going to dispense, I have prescribed and I'm going to dispense X, Y, Z, so just so that there is those guardrails really for both the patient and the prescriber. I don't know what your thoughts would be about that.
Yeah, 100%. I think we all have our support groups in our pharmacy full scope journeys, and we are calling on each other as appropriate and sometimes quite consistently. There's a group of 4 of us at our pharmacy that are working at full scope, and we are continually talking to each other during cases and sometimes after a case, just to make sure we're working safely within this new journey. So if it was a case where we had to do that, 100% we would be calling a colleague just to check that we're being safe and we're working within the guidelines. Obviously, the preference is not to be the prescriber and the dispenser, but if it's any kind of emergency or, again, we've got to put the patient at the centre of this moment. And if it's in the patient's best interest that occurs, then maybe it should occur. But it shouldn't be what we go for.
And of course, there are instances where you've been doing this very safely for some time. For example, emergency contraception.
Yes, and conjunctivitis, and somewhat more recently, but still been going for probably 4 or 5 years, simple UTI infections. And to a degree, we've been doing it all over the time, even with just over-the-counter medications, just for normal pain relief, allergies, the things that are behind the counter, which sometimes we forget is still a diagnosis and supply of medication. So it's something that pharmacies have been doing. It's just a different level now.
Peter, you mentioned patients coming in with conjunctivitis. This has been part of your usual practice for some time. Could you just talk us through how you, even before you became an endorsed pharmacist, how you might manage that?
Well, I think there's a big misconception that all conjunctivitis needs treatment with an antibacterial. And as we know, most of it's viral, most of it's self-limiting and doesn't actually require treatment. So again, it's just about putting that skill set around what we do as pharmacists. And if you come into our pharmacy and ask for a product, then we'll properly triage it and actually make sure you're walking out the door with a product only when it's needed. And generally, it's more lifestyle advice or non-pharmaceutical treatments are way more suitable for conjunctivitis.
Fantastic. Okay, guys. Well, we're coming towards the end of our session. And look, I wanted to ask you both, so what does this CPD Plus offer endorsed pharmacy? Over to you, Peter.
Right. Well, it's very practical, real-world clinical education. The content is designed by the team and it's focused purely on full scope practicing pharmacists, ongoing updates on scope and regulatory involvement, access to lovely experienced clinical educators who can help us on our journey, case-based learning rather than just purely theoretical. So a lot of it is very practical, case-based stuff, not stuff you could just read. There are resources that can be immediately applied to our practice as well. So, and it does that CPD that's really just focused on endorsed pharmacists, rather than just being the general CPD that you're just doing to tick a box to get your number of points. So if you're going to make a CPD choice, then CPD Plus as an endorsed pharmacist just makes a whole lot of sense.
Yeah, thanks, Ewan. If I could follow that up as well, I think right from the beginning of my involvement with this, I've been very focused on how we're going to support pharmacists who go through this, because they will complete their new qualification. Obviously, they're experienced pharmacists, but they will be young clinicians in terms of this part of their scope. And so what's going to be the fit for purpose CPD that's really going to help support them and help them grow their confidence and their competence as they go through this. And so that was our thinking, Ewan, as you know, in setting that. So it's very fit for purpose. It really encourages people to be reflective, to have their recency of practice, make sure that those newer clinical skills, or for some people, completely new clinical skills, are consolidated and supported.
Okay, well, thank you very much, everybody, and thank you for being here for our first CPD Plus podcast. I'd invite all those listeners and to talk and share your experience and to see if we can get more and more members listening to this podcast. Our next session will be looking at around hormone contraception, and we'll have some expertise with us speaking about the importance of diagnosis, assessment and management of contraception and the critical role of their community pharmacists in that. So thank you very much, everybody, and we'll see you next time.
Yeah.
Well,